Hi. All right. I am just going to quickly check and make sure that I am live. If you are seeing me, go ahead and say hi. Make sure to use your name in case you haven't given StreamYard access, because I am using StreamYard in order to tackle a couple birds with one stone and do this live in a couple of my groups so that more people can get access to it all at one time. And save me time a little bit too. So I do see that I am live in at least one of the groups. I'm going to just go ahead and check on another one. So just say hi. What do you got going on? Hey, hey, what do you got going on this weekend? And, or tell me, did you get 3 inches of snow? Because we got 3 inches of snow yesterday. And on March 10th, I'm not real happy about that. Woohoo! Okay, live. Thank you, Sarah. Okay. So I am really excited to be going over this topic. Depending on which group you're in and you're watching this, or maybe you end up watching this on YouTube later as I upload it, supplements are a huge market, right? A huge market. Oh, I know. I wish we were going to be there too. We got way too many things going on at one time. But April, so close. It's a huge industry. And there are so many companies out there and so much information out there that it's really hard to discern. Is it necessary? Why do we need it? What do we need? All the things, right? Well, as a physical therapist, so if you're jumping on and you don't know who I am. So my background, I have my doctorate in physical therapy. I'm a board certified neurologic clinical specialist. I hold other certifications in areas such as vestibular therapy, multiple sclerosis, Parkinson's disease, concussion, craniofacial, migraine headache, you name it. I've dug into it. Okay. And with that, there's been a lot of education that I've gone through on the physical side, but in the last few years, I've really dug into the holistic side. And I really believe strongly in the utilization of our food for our primary nutrient. But unfortunately, our food is different. Our food is not what it used to be. And what I'm going to talk about is that it's not just our food. Our food is different. Our soil is different. The processing of it all is different. But in addition to that, we have become so dependent as a society on pharmaceuticals and medications, and so many do not understand what certain types of medications are doing to literally block your body's ability to extract nutrients from what you eat. So even if you are eating well and you are just it's just unfortunate that you also have medication that you have to be on, right? And I'm not saying that these medications are bad, because many of them are necessary based on the diagnoses you have, right? But our bodies aren't able to then utilize our food for the nutrients that it needs. So what I'm going to talk about today is how do we give our bodies what it needs while taking into account all the things. Okay. So I did put a presentation together. I'm going to go and pull this up, and then I'm going to share my screen with you. So what I want to know is, as I'm pulling this up, I'd love to know from those that are watching or when you jump on the replay, what are the top 3 supplements that you feel you need or that you take? Top 3, whether that's vitamin D, vitamin B, vitamin E, multivitamin, zinc, melatonin, B12, CoQ10. What are the top 3 that either you've been told, you feel like you've been educated on, or that you've just decided on your own because you've done your own research that you take on a regular basis? And if you don't have 3, give me your top 1. And if you don't take any, tell me that too. Okay. So here's what I'm going to do. I'm going to turn this into presentation mode. There we go. I'm going to do this. I don't need this. We're going to take this out of the way. Okay. All right, and then I'm going to make sure I can see you, and then we're going to share my screen. Oh, that's cool. You can now share your slides directly. I didn't know that. We'll try that next time. Okay. Guys, me and technology. Woofda. I'm not the greatest. Okay, so supplements. Do we really need them? Okay. And what I am, what I'm going to start off here, and you'll understand this a little bit more as I go on. Okay. Gut enzyme, omega-3, iron, and vitamin E. Okay. So I'm going to touch on a couple of those, not on all of those. And guys, I'm going to try and keep this presentation to under 30 minutes. So this is literally the tip of the iceberg. But yesterday and the day before, I listened to a podcast, and then I also took a continuing education course. So I'm in the process of renewing my physical therapy license, and I took a continuing education course for health professionals on supplements. And it was amazing information, just absolutely amazing information. So quick FDA disclaimer: the information I'm going to present has not been evaluated by the Food and Drug Administration or any other medical body. I do not aim to diagnose, treat, cure, or prevent any illness or disease. Information is shared for educational purposes only. You must consult your doctor before acting on any content in this presentation, especially if you are nursing, pregnant, taking medication, or have a medical condition. You get it. Okay. That's my disclaimer. Okay. On to the good stuff. So, supplements versus food. I truly do believe that our food, what we eat, should be our primary source of our nutrition. Okay. Primary, first and foremost, a well balanced, whole food, raw, plant based diet is going to give us, and not all plants, you're going to see all this. But anyway, a well balanced diet is what you should be focused on first. But unfortunately, it is very difficult, even with a well balanced diet, to get the nutrition that you need for very many reasons. And I'm going to talk about that. This is one of the functional medicine doctors that I follow. He is phenomenal. He's got tons of resources, written lots of books, and I'm going to talk to you about some books too. But the quote from him says, if you eat only wild food that you hunt and gather, drink pure clean water, breathe clean air, have no chronic stress, are exposed to no environmental toxins, sleep 9 hours a night, you don't need vitamins. But the rest of us do. So tell me, are you one of those people? I would love to be one of those people. I am not one of those people. I am trying very hard. Clean air, clean water, we're growing food, we're trying, but it is very hard to fit every single one of those criteria in this day and age. Okay. Susie Cohen is a pharmacist, but I'm going to talk more about her book that's called Drug Muggers. Hey, Laura. And she's a pharmacist that is putting out the information that we need that balances the pharmaceutical side, the food side, and the supplement side. Okay. So vitamins are present in fresh, raw vegetables and fruits, but they are not in sufficient quantities to promote good health, reverse disease, or counteract all the toxins that surround us. Unfortunately, our food is often grown in mineral deficient soil that contains a lot of pesticides, which are all inflammatory. Okay. So a lot of everything that I am going to talk about today has come from books that I have read, or that the presentations I have been a part of have read the books and summarized it using these. Okay. So these are just a few of them. I encourage you, if you're watching this, or if you come back and watch the screenshot, watch the replay, screenshot this. Not all of these are like super easy reads if you're not a healthcare professional, but all of them have tremendous amounts of information. And so my goal is that as I get through each of these, so I personally have fully read The Disease Delusion. I've gotten through most of Eat to Beat Disease, and I have recently started on Drug Muggers. So these are all books that you can find on Amazon or, in your libraries, and that will help you in understanding the nutrition side and supplements and balancing it all. Okay. Additionally, I'm not even going to have time to get into this, but I very firmly believe that our gut is a central component to our overall health, and that is emphasized in all of those books that I just had on the screen. These are all books that I have personally read. This is just the tip. I love reading Dr. Furman's book. Okay. So yeah, if you have other book recommendations, throw them in the comments. I love the resources you can find from these books. So if you've got other books that you love, that you've read, that you find to be helpful, drop those in the comments for everyone to see. I think that would be super helpful. So these are all books that focus on the gut itself. And I truly believe I will eventually do an entire presentation on just gut health because there is enough to do multiple. Okay. But these are some of the ones that I have personally read that I have found to be most impactful. Okay. All right. So let's talk a little bit about supplement history first. Okay. So you will sometimes see RDA or RDI. And what that means is recommended daily allowance or recommended daily intake from a supplement standpoint. This is very misleading. Okay. These recommendations were made for the average person to prevent like extreme disease like scurvy or things like that. But it is not a recommendation for how much to prevent a chronic disease. It is not a recommendation that takes into account optimal function. And it is not a recommendation for how to replace deficiencies if you are deficient. So these RDAs and RDIs can be really misleading, okay? But they've got to start somewhere, okay? It is important to understand that supplements are not substitutions for real food. Food are cofactors. We need real food, the ones that you chew and chomp and use your teeth to get the nutrients out of. And that's a whole nother system. How much do you chew? How many bites do you take each time you put food in your mouth? Did you know that that can have an impact on how much you're extracting from the food itself? Whole nother thing I could talk about. That comes into the craniofacial stuff, okay? But supplements are not substitutions for real food. In the USA, supplements, okay, this is really important. Supplements are not allowed to treat disease. They are only allowed to make structure or function claims. So at the bottom of the slide, you're going to see a link to an article. This is from Susie Cohen, the pharmacist I talked about, on how our language is controlled. And what this is referring to is how the supplement industry language is controlled. Okay. And it is very specific. So a vitamin, and you'll understand why this is so important to know when I get into some of the future slides. But vitamins are not allowed to list what disease they can fix. They used to be allowed. At some point, one of our administrations made it illegal. Okay. A supplement or a vitamin is not allowed to say, this supplement treats insomnia. Insert any disease, okay? Migraine, irritable bowel syndrome, dementia. Insert any disease. It cannot say this supplement treats this. What it can say is this supplement supports healthy circadian rhythms. See the difference? Okay. And this is due to FDA regulations. FDA regulations, FDA, the Food and Drug Administration, works for the pharmaceutical companies. So only pharmaceutical companies can make disease claims. Only drugs are FDA approved. Okay. Very important to understand that. Here's some examples, okay, on how slight changes would allow something that is herbal or supplement type, supplement category, to have disease claims, okay? The prescription drug Marinol is actually marijuana, but that specific type of marijuana has a slightly different chemical structure that allowed it to become FDA approved, okay? It is thus synthetic, and so it can make disease claims, but it's marijuana, okay? Deplin is an FDA approved version of folate, which is a very important B vitamin, or is what some may know as 5-MTHF, okay? This specific medication is available in incredibly high doses, 7.5 milligrams, 15 milligrams, high doses, okay? It is sold specifically for the indication to treat depression. However, it is a B vitamin. It is folate. It is methyl MTHF. I forget what the HF stands for, okay? It is the vitamin, but the vitamin version, the natural version of folate or 5-MTHF can only say it is to support a healthy mood, even though it would have an impact on that diagnosis, on that disease. Okay. Supplements cannot say these pills relieve the pain of osteoarthritis and tendonitis. It would have to say or be marketed as supports healthy joints, cartilage tendon. Okay. Some other examples cannot say treat dementia, would have to be marketed as nootropic or support a healthy brain, or this formula supports healthy cognitive function or brain power. Okay. You cannot say vitamin D will help with respiratory infections or Hashimoto's thyroiditis, which it does. The supplement, the vitamin D supplement, could only be marketed as supporting healthy respiratory system or healthy thyroid function. Okay? Cannot say cure insulin resistance and diabetes. Can say supports a healthy pancreas. But can you see, because of the restrictions on language, how supplements become very difficult to navigate when you are trying to look for something to help in a more natural way, but the companies themselves are restricted, unable, like legally unable to actually put what it is that it does. Okay. And that's where the confusion comes in. Okay. So let's get, so I want you to understand that, because it is important to understand that when supplement companies are saying, we can't make those claims, we can't do this, we legally, those companies cannot, even though hundreds of years of research would support that the certain vitamins, minerals, things like that do those things. Okay. All right. So what are the top 3 reasons someone may need a supplement? The first would be that it's not absorbed by the body. So the most common example of that is that vitamins A, D, E, and K are fat-soluble vitamins, and thus they need an adequate fat supply in the diet to be absorbed by the body. Okay. Insufficient stomach acid. So if you are someone, or you know someone who has been on what's called a proton pump inhibitor or a stomach acid reducer, okay, they likely do not have the stomach acid necessary to break down the foods to then extract the nutrients. There has been a positive correlation now into dementia and long-term use of PPIs because they block the stomach acid. This leaves people vulnerable to infections. And in addition to just the PPIs, prolonged use of acetaminophen, NSAIDs, and antibiotics also have an effect on stomach acid. Okay. And then the last one would be gut dysfunction, which is why I brought up the gut books, okay? Because gut dysfunction, well, I'm glad. Gut dysfunction in and of itself is one of the primary reasons why you would need supplements, okay? So why might you be deficient in a nutrient? Why might your body not have the nutrients it needs? So it could be lacking in your diet. A high sugar diet will automatically block the body's ability to absorb it. Okay. It's not absorbed. We talked about why. Okay. Medications can block or deplete it. I'm going to bring that up. Okay. And medical treatment, such as for cancer, infection, and toxin exposure, may make you deficient. And then personal choice, meaning that you just are choosing not to do the things necessary. Okay. All right. I am not going to get into dose recommendations today, but here are 4 of the top people that I personally follow and utilize for recommendations. And each of them has slightly different variations on their recommendations, but they all are pretty in consensus on what they recommend. And so here is kind of the top recommendations that they make in regards to supplements. Okay, so multivitamin, vitamin D, magnesium, you see those pretty much, B vitamins, and then it varies a little bit as far as fish oil, things like that. I'm also not going to get into all the specifics today. I am going to touch on a few specifics. I'm not going to get into all of them. I would, and as you're listening, if there is something in particular you would like me to dig deeper into, that's exactly what these feature Fridays are for. let's dig deep. Let's dig deep into what it is that you want more information on. I know I started off doing, products. I will continue to do more products as well. But I also would love to dig deep into topics. So if there are topics that you would like me to dig deep into, I would love to do that for you. Okay. So that's what Feature Friday is all about. So I'm putting this up here. What is a proton pump inhibitor, an acid blocker, an antacid? What are the generic names for them? Okay. Omeprazole is probably the one that I see the most, and the side effects alone of omeprazole are scary. Okay. But what's important to understand is that acid blockers and antacids block the absorption of every single nutrient. Every single nutrient is blocked from being absorbed inside your body if you or someone you know takes any of these medications, which are now all over the counter. Okay. Super important to know. All right. First one we're going to talk about today. So I'm going to go into a few specifics. Okay. And they're kind of like the big ones out there right now, as far as like the major ones that people are talking about. Okay. Vitamin D. We've heard a lot about this because of where our world is in the last 2 years. Okay. So vitamin D deficiency. Woo. Yeah. See you guys. Me and technology. All right. I'm gonna stop sharing for a second. Let me get me back here. Somehow I scrolled through all of them. Give me a sec. Oh, it went to the end. Okay, hold on. Here we go. Okay, I'm back. Here we go. Okay, so vitamin D. Look at everything that a vitamin D deficiency is associated with. Okay, it is important to understand, if you live north of the equator, you likely do not get enough sun exposure. Okay, and there is like a certain latitude. There's actually a very specific latitude, longitude. No, I think it's like north of Georgia. I don't know. I don't remember what it exactly is. But basically, if you live in the US, you aren't getting enough adequate sun exposure. And so you do need vitamin D supplementation, food or supplement, one or the other. Okay. This hormone alone, vitamin D, okay, regulates all of this. Okay. And this is where this comes from. It's a YouTube video, but it's very good. D is for debacle, the crucial story of vitamin D in human health. Very, very good. Highly recommend it. But everything, cancer, influenza, various blood disorders, diabetes, osteoporosis, asthma, multiple sclerosis, heart disease, thyroid issues, inflammation. I mean, you talk about it, it's pretty much the major diagnoses you hear about all over the world, right? Okay. Or at least in the US. We'll go with US. So what could be, in addition to just not getting out in the sun enough, if you are on any of these types of medications, it is also blocking your ability for your body to absorb the vitamin D. So we're talking acid blockers, anticonvulsants, statins, other cholesterol agents, corticosteroids. Not that they're bad. One of the things that was brought up to me that was eye-opening, Flonase. Flonase is a corticosteroid. Flonase is very commonly used, especially this time of year as we enter spring and allergies get bad, right? Flonase is a corticosteroid. It can impact your body's ability to absorb your vitamin D. Okay. What can you eat? Okay. What can you eat that will help with your vitamin D? Wild cold water seafood, milk, liver, egg yolks, fortified cereal. I thought I made this slide prettier. Eventually, I'll make it prettier. But if those are not regular parts of your daily, weekly diet, you may need vitamin D supplementation. And that is the point of this, is kind of what I'm going over. Okay. That is why if you don't eat this and you take any of those medications and you aren't getting out in the sun and you have any of the signs and symptoms that I pointed to before, you may need a vitamin D supplement. Okay. It is important that your vitamin D supplement is a D3 and optimally combined with K. I'm not going to go deep into that. I did do an immunity presentation a while back that talks more about that. You can look it up or ask who, added you here, or comment that you would like the immunity presentation and we will get that to you. Okay. Yes. Yeah. Friends on vitamin D and Flonase and acid pill. Absolutely. So like she actually, that type of person, okay, that's taking a vitamin D supplement, but is using Flonase and an acid blocker, is going to need a much higher value of vitamin D to actually get the amount of nutrients that they need, because the Flonase and the acid blocker are working against the supplementation. So that recommended daily intake of 2000 IU is not going to be enough for that person. They're going to need to increase it because of the counteraction of the other products that they're on. Okay. What's most important for your vitamin D is sunshine. And guys, even if it is 30 degrees outside, if you can get out there 15 minutes of sunshine is adequate to give your body, to allow your skin to make enough to turn it in, do all it needs to do to process it for your body to make the hormone vitamin D. Okay. 15 minutes in the sun. Okay. But even in the wintertime, especially in the wintertime, most people just are not getting that exposure. Okay. The next one I'm going to talk about is B12. So what does running low on B12 look like? Okay. You feel tired. You could have fatigue, weakness, especially in the arms and legs, depression, forgetfulness, easy bruising, peripheral neuropathy. Many people run out of B12 because they're taking drug muggers, which I'm going to talk about. Junk food and refined white sugar strip your gut of the essential components that you need to make and absorb B12. Okay. As a physical therapist, reading this, and as a neurologic physical therapist, nonetheless, the fatigue, the weakness, the dementia, the depression, the peripheral neuropathy, those were like 5 of the top most common symptoms I had patients coming to see me for. And while we had to work out whether it was mechanical or not, now knowing what I know, I'm not in the clinic anymore, I would start with nutrition. I would start asking them what they were eating, and I would be much more intent on looking at their medication list. Okay. So what could you possibly be taking that would block your body's ability to absorb or extract B12? Look at this list, you guys. This is a lot, and many of which you likely know someone who's taking at least one, if not multiple of these all at the same time. Okay. All right. So from a food standpoint, what can you eat that will help you with B12? Okay. Beef liver, liverwurst, snapper, venison, shrimp, scallop, salmon, beef, lamb. A lot of it is, you can tell it's animal based, right? Tofu, miso. There is some vegan, the tofu, the miso, the tempeh. You've got cow's milk, blue cheese, eggs, halibut. So again, and I didn't get into like recommended amounts of these even, okay? But just looking at this list, if this list is not, you don't find things that you are regularly eating within your diet, you may have a vitamin B12 deficiency. Okay. And in that sense, you likely need a supplement for that. And the variations and the amount that you need is going to vary. Okay. Last one I'm going to talk about is going to be magnesium deficiency. Okay. So this is a big one right now. Magnesium deficiency will present itself as headaches, migraines, constipation, depression, anxiety, heart palpitations, menstrual cramps, spasms, muscle cramps, insomnia, fibromyalgia like pain and tenderness. Again, okay, that deficiency can cover a wide range of things. Think of magnesium as a relaxer. Okay, it's going to relax the blood vessels. It's going to relax the heart. It's going to relax the muscles. It's going to relax to allow blood flow. It's going to relax to release tension. Magnesium is a relaxer. Okay. So what could you be taking as far as medications that would be blocking your body's ability to absorb magnesium? Antibiotics, blood pressure, corticosteroids, remember, Flonase, hormone replacement. But in addition, from a food standpoint, coffee, alcohol, high sugar, and more additionally deplete your body of magnesium. Now, there are a few different variations of magnesium. The two I'm going to tell you that I'm going to point out, magnesium citrate is good if you are someone who is constipated and is looking to trial magnesium in order to improve your bowel motility. But if you are not constipated, you may not, you don't want magnesium citrate. You're going to be more beneficial on a magnesium glycinate, a chelated mineral, a chelated magnesium form. It is also possible that if you are someone who is constipated, but also is having some of those other symptoms, let's say that you're also having headaches and migraines, depression, anxiety, and menstrual cramps, okay? You may need both. So if you have constipation and like I would say at least two of the other symptoms, you may benefit from both a magnesium citrate and a magnesium glycinate at different levels in order to treat it all. Okay. But magnesium is a really important one. Okay. From a oh, guys, I copied the wrong one. Okay. Hold on. Okay. I will find the slide and I'll put it in the comments of what to eat from a magnesium standpoint, because I apparently, oh, you know what? I've got my, okay, magnesium. So if you are not eating dark leafy greens, pumpkin seeds, almonds, dark chocolate, black beans, quinoa, and baked potato with the skin on it, those would be great food sources of magnesium. If those are not ones that you are regularly eating or regularly a part of your diet, again, there is a possibility that you have a magnesium deficiency. Okay. The last thing I want to, so this was the wrong one. Have no glad, right? Yeah. So again, like something like that. So someone commented, have no gallbladder and no ovaries, had breast cancer, 6 years survived. That is amazing. I'm so happy that you have gotten through that. That is just, that in itself is amazing. But then you've also got to think from a no gallbladder, no ovaries, what is that doing from a hormone function standpoint? What is that doing from the gallbladder is very important in the production of enzymes and especially digestive enzymes. What is that doing in that regard? Okay. The last thing I wanted to touch on is from a drug standpoint, from a medication standpoint, what is it that's specifically impacting your good gut bacteria? Okay. And acid blockers. This is why I put that slide on there very back in the beginning. Antibiotics and antivirals, hormone replacement therapy, and most over-the-counter medications are blocking or depleting your beneficial gut bacteria. Okay. So I'm going to go ahead and stop sharing here. That is why you will hear that we need supplementation. Okay. It is not because these companies are trying to sell you the next best thing. It is not because they're trying. The supplement companies that are really trying to get at internal health are doing it because they know where we are lacking. Okay. The last thing I want to pull up is just a little bit about, okay, so I just want to throw out some statistics for you to end this, okay? And go ahead, where do we find magnesium chelate? So a chelate, what you want to look for is something that's called glycinated. So that's the most magnesium wrapped in glycinate. Personally, I have been using our Balance, which is a multivitamin that has the magnesium chelate as a part of it. My personal experience with magnesium, I suffered severely from hemiplegic migraines. I gradually had to work up to taking 500 milligrams of over-the-counter magnesium. This was before I understood the different types, okay? Because of the impact it can have on, it can actually make you constipated and all the things, okay? When I switched from a magnesium-only supplement to this plant-based herbal blend multivitamin, in addition to other changes I was making, I have been migraine free for a year, and there is a lot that goes into that. But I strongly believe the sourcing of your supplements is incredibly important, incredibly important. So I can't see who asked that question, but when I do get back in and I can see the name, I will be happy to contact you directly to talk to you a little bit more about that. So just a few stats I want to throw out there. This is from a podcast from Dr. Hyman, okay, on supplements, okay. 68% of the population is not getting enough magnesium, okay? 40% of the population is not getting enough zinc. 70% is not getting enough folate, which is your B vitamin, and upwards of 90% are not getting enough omega 3s. In the body, those minerals themselves, okay, there's 37 million chemical reactions happening each day within the body, and each of them requires vitamins and minerals as helpers, as cofactors. One third of our DNA codes for the catalyst or the enzymes necessary in these reactions. Okay, so if that much of our DNA is coding for it, you know it's important, right? From a physician standpoint, 72% recommend supplements and 79% are taking themselves, but 70% of the population taking supplements are not doing it under a physician guided treatment plan. They're doing it on their own. And that's 70% of the population, but 70% of the population probably doesn't know all of this about the different types and the RDIs and the RDAs. And so that's what we're here to do. I want to educate you so that you can make the best and most informed decision on supplements and what's going to work best in your body. So you're not paying for expensive pee. Okay. The best ways to uncover if you have a deficiency is a physical exam, biomarkers. These are things that you would need to go to a physician or a functional medicine practitioner in order to have done, but it can be very helpful if you want to know where to start. Okay. They do recommend a nutrient dense diet, depending on, what you've got going on, but certain diets also need to be under the, umbrella of physician guided, right? So this is just, and they don't all have to be. You can go through this yourself. I am of the mindset that I have taken I've taken it upon myself to read these books, to do these things, to take this information, and I want to share. I want to put it out there so that other people can know it too, because not everyone has time to read all these books or trying to extrapolate from it what it is that is what it's trying to say is not the easiest thing for everyone. So I hope that this was helpful. I'm just trying to see if there was anything else I wanted to throw out there. No. Okay. I hope that this was helpful. I'd love to answer any other questions that you might have. So I'll give about a minute for that just to see if anyone else has any other questions. Otherwise, as you watch this on the replay, if you do end up having questions, please comment below and you can tag me in it, or I will just watch it and come back and answer it for you. But yeah, this is just the tip of the iceberg. I plan on coming back and doing more on this as I dig into it a little bit more and can extrapolate more information from it, and want to share it and want to make sure that you are as well informed as I can help you be in regards to all of this. So happy Friday, and I hope that you have the CE. So the CE course was called Learn About Supplements. And it was Learn About Supplements through Rehab Connections. So that was the physical therapy course I just recently took. She also does Food for Function was one that I just recently took, and Learn About Lab Tests. All very, very good, very enlightening. You actually, I found out through all that you can order lab tests on your own. You may be able to submit them to insurance for reimbursement. But if you don't have a physician that's ordering like your vitamins and your mineral levels and things like that, you can order all of that through certain websites and go to a Quest Diagnostics or a lab near you and have those run, and you'll get the reports, and you can kind of look at your own levels. And those same physicians that I had listed in the beginning have a various recommendations on what optimal function looks like in lab work. And so I find that I'm using that now to monitor my own family's lab work and that kind of thing. So just lots out there on what we can do to optimize our diets, our supplements, our nutrition. And for me, I am working to stay away from the medications. I am on 0 pharmaceuticals for the first time in nearly 30, how old am I? 36 years. I think I started at age 5. So we'll say for 30 years, I have been on some type of medication for one of my many ailments. And as I learn more and more about this, I am so blessed. I am so grateful. I thank God every day for where I am in my journey. Because it's not an easy task to undertake. And that is why I love to share this as much as I can. So I hope everyone has a beautiful, wonderful, blessed weekend. And if you have questions, let me know.